I'm Rebekah Azalia Alexander, and it's my pleasure to welcome you to this United States of Care event, Empowering Voters, How to Talk to Candidates About Healthcare. I'm here to share with you why voting and healthcare are important to me. But before I do, I'd like to ask each and every one of you watching to take a moment to message a person in your life that could benefit from what we're about to share. Send a text or DM. It only takes a second. All right, your job is done for now. Thank you very much. As I said, my name is Rebekah Azalia Alexander. I was born and raised in New York City, though I currently live in New Haven, Connecticut with my partner. I am extremely blessed and fortunate to say I also work as a fundraiser within the development office at Yale University. I have spent the better part of the last 10 years caregiving for my aging and ill loved ones. This experience has shaped my life in ways a young 20-something millennial way back in 2011 could never have imagined. It has also emboldened my resolve to have healthcare policies at the forefront of every electoral discussion, especially this year. Like many of you, healthcare is important to me because it has impacted me. I am a co-caregiver to my soon-to-be 80-year-old grandmother, as well as the primary caregiver to my mother, who is a young stroke survivor. I honestly can't remember a time when I wasn't in some capacity providing care for loved ones with at times complicated medical needs. In this role, I have witnessed and bore the consequences for a fragmented medical system that places an incredible amount of fiscal and logistical pressure on families that have only been exacerbated by our current public health and economic crisis. I'm an only child and only grandchild. Trying to ensure that everyone is well cared for and financially supported means that I couldn't afford to just stay at home and care for them, unlike what our current medical system expects. I must continue to pursue professional and economic opportunities because the well-being of my loved ones long-term depends on it. As a young woman preparing to both continue these care roles, in addition to preparing to start my own family in the near future, it is imperative to me that anyone who is running for elected office during these critical times be prepared to answer tough questions regarding their positions on healthcare policy. Addressing the sheer cost of healthcare, support services for caregivers, modifying the exorbitant cost of healthcare delivery, even coverage of pre-existing conditions. The disparities we are witnessing in both the infection and mortality rates from COVID-19 across the nation cast a glaring light on all the gaping holes in access to adequate healthcare. There is no version of the immediate or long-term future where we as a nation don't face tough decisions that are indelibly tied to our healthcare outcomes and our commitment to expanding access and resources for all Americans. Because of my experiences to date, I believe it is my responsibility to take my perspective, questions, and concerns to candidates, to educate, to understand their position, and inform my vote. I know you're with me in this effort, and I'm excited that you've tuned in for this event. There's a great lineup of expert speakers who will share how you can talk to candidates about healthcare. Thank you, and enjoy the show.
Welcome to the United States of Care event, Empowering Voters, How to Talk to Candidates About Healthcare. We have a great program for you today, and before we get to our other speakers, I want to share a little bit about United States of Care. United States of Care is a nonpartisan, nonprofit organization founded in 2018 by a diverse group of policymakers, advocates, regular people, healthcare providers, entrepreneurs, community leaders, and more. Our mission is to ensure that everyone in the country has access to quality, affordable healthcare, regardless of health status, social need, or income. We must change the conversation and create a new narrative that puts healthcare over politics by focusing on people's needs, not political considerations, and supporting a positive, practical, and lasting approach to improving healthcare access for all of us. Our country is at a pivotal moment, and our mission has never been more relevant or more important than right now. The COVID pandemic, economic downturn, and national movement for racial justice all shine a light on longstanding gaps and critical inequities in our healthcare system. Since the pandemic began, United States of Care has shifted our resources to support COVID-19 response efforts. We have coalesced our network of experts, including our Founders Council members, Entrepreneurs Council, and Voices of Real Life, to serve as resources in finding solutions during this critical time. We've done listening research with people across the country and released a number of valuable resources and recommendations to healthcare leaders, as well as providing expert assistance to federal and state policymakers. Most recently, we released healthcare guides for candidates and voters, which we'll talk more about today. As we enter the home stretch of this election, amid the worst public health crisis in 100 years, healthcare remains among voters' top priorities. The American people are counting on candidates up and down the ballot to offer practical solutions to both their immediate challenges and the long-term gaps in our healthcare system. The economic fallout of the pandemic has jeopardized access to insurance. Nearly 27 million Americans are at risk of losing health insurance from their job. An estimated 12.7 million would be eligible for Medicaid, our insurance safety net. 8.4 million could qualify for subsidies on insurance marketplaces, and 5.7 million people would need to cover the cost of health insurance policies on their own or remain uninsured. Seniors are at greatest risk. As of July 22nd, 80% of COVID deaths in the United States were among people aged 65 or older. A disproportionate number of those infected by COVID-19 are Black, Indigenous, and people of color. According to recent CDC data, 31.4% of cases and 17% of deaths are among Latino residents, and 19.9% of cases and 22.4% of deaths were among Black residents. They make up 18.5% and 13.4% of the total population, respectively. That is why it's so important for every person to vote and engage with candidates to make sure they support policies that will make healthcare more affordable to us all. USofCare's research indicates that the American people want the healthcare system to emerge stronger from COVID. In other words, it's not enough to get through this crisis and go back to the system we had before, which wasn't working for too many of us. They want a system that delivers outcomes in which people have the certainty they can afford their healthcare. People have the security and freedom that dependable healthcare coverage provides as life changes. People can get the personalized care they need, when they need it, and how they need it. And people experience a healthcare system that's understandable and easy to navigate. This election season, whether you're attending a virtual town hall, hosting a candidate coffee hour, or listening to a candidate forum, we want to make sure you and the people in your community have the tools to ask candidates about healthcare and how they aim to make it a more people-centered, effective system. I want to take a minute to thank our speakers today, to all of those tuning in and getting ready to vote, and to today's event sponsors and partners. I'm fortunate to be here with United States of Care board member, Jim Douglas, former governor of Vermont.
Of course, sometimes candidates try to be unreachable, but it's the responsibility of the electorate to reach out and to interact with them and to try to get a sense of where they stand on issues that are important to their constituency. I certainly found that very valuable in my experience in running for office. I wanted to be with and among Vermonters to understand their priorities, their hopes, their aspirations, their concerns. And I certainly hope that others who seek elective office feel the same way. This is an unusual campaign season, obviously, because of the pandemic. So access to candidates may be a little more challenging than it is in a normal season, but still through virtual and some in-person opportunities, there are those occasions when candidates can be engaged. I guess one thing I'd suggest to folks who want to approach candidates is to be respectful. We obviously have differences of opinion on a wide range of issues, but I've always found that it's not likely that someone is going to be listening if the approach is hostile. You can't seek to delegitimize someone's view, even if it's different from your own. You need to listen to it, to understand it, and then I think you'll have a better basis on which to engage that individual. So I think respectful approaches are important. And, you know, even if a candidate initially doesn't give a response that is satisfying to the person who's asking, politicians do change their minds. Sometimes when they assume office, they have access to different experiences, more information. And so I think establishing that relationship, even if it's not one where there's total agreement initially, is an important step.
And why is it important that voters understand candidates' beliefs and commitments when it comes to healthcare access and coverage and where they stand?
Well, I think it's important to engage candidates where they are. Some may have a very different point of view from the person who's asking. In other cases, the differences may be more subtle. So it's important to understand exactly where that candidate is coming from on a particular issue. So you know how to engage him or her and what particular points to emphasize and how to begin the conversation. There are different ways, of course, to do that. Many candidates have websites with policy pronouncements and statements of their views on issues. Sometimes they're more specific than others, but at least it's a place to start. And you know, I would certainly encourage voters to seek out opportunities, whether it's an online forum or one where candidates come with appropriate physical distancing to appear live, and be there and begin to build that relationship. The best outcome is that the candidate knows who you are and is willing to interact with you on an ongoing basis.
Can you tell us about an impactful interaction that you had with a voter?
Well, I think of a number, many. In fact, a lot of people commented on how much I got around Vermont, how many people I met during the course of a day or a week or a month. And that really gave me an opportunity to understand what Vermonters' priorities and hopes and concerns were. In the healthcare field, I recall a meeting early in my first campaign with the parents of a young woman who took her life after a drug overdose. And that was very meaningful to me. It was poignant. It was important for me to talk with these parents who'd had this devastating experience and who were willing to share that with a candidate for governor and use their misfortune to try to make something good of it. So I appointed her dad to my drug abuse and advisory council, and he served there throughout most of my tenure to offer advice to me on how to deal with other circumstances like that. So that was a very important relationship that I still value. I talked with a family that took advantage of our Choices for Care program. That's where elderly and disabled Vermonters had the opportunity through the Medicaid program to remain at home rather than to go into an institution. And this particular family whose home I visited had a disabled daughter who would have been institutionalized, but instead was cared for by her mom, a nurse, in their own home. And I checked back with them a few years later, and she was taking courses at the community college. She had a part-time job, and it was exactly the outcome that we had hoped, but it helped me personalize the experience to see a family that was actually taking advantage of it. I met with those who lost loved ones to suicide. I met with parents of autistic children to understand their experiences and needs. So all of these opportunities helped me develop a deeper understanding of the needs of many people in our state and helped me make those priorities in our efforts at reform.
Thank you. It's really impactful to just hear about, how those personal stories really can become a part of where your policy priorities and focus are. Did you ever have an interaction that with a voter that challenged how you thought about an issue? And certainly you've shared some that talked about how you reprioritized.
Well, I guess I remember the first time I was picketed. I thought, well, I guess I've arrived. That's one way of expressing a point of view, or see some unpleasant posters or banners taking me to task. And as I suggested earlier, I don't think that's the best approach. I think we don't need to demonize people who have a different point of view, but to engage them. And I certainly have been approached by people or asked at forums some very tough, probing, borderline impolite questions, but that's okay. I'd rather have that direct dialogue than to have someone just demonstrate and not engage, because then I really don't have the opportunity to engage in a discussion and hear where he or she is coming from.
Great. Well, thank you so much for spending time with us today and sharing some of your experiences. I think as voters engage, it certainly might be more like this on different boxes on the screen this year, but I think the advice still stands. So really appreciate you taking the time today, Governor.
My pleasure, Emily.
Up next, we'll hear from Erin Huppert, Director of State External Affairs and Partnerships at United States of Care, to present the Voter Action Guide.
As you heard from Emily and Governor Douglas, this is a pivotal election, and despite limitations in how we can interact in person this year, it has never been more important for you to engage with candidates to tell them what is most important to you, and for you to hear how they will tackle some of our community's most challenging issues. Healthcare is high among them. The pandemic, economic recession, and new questions concerning the future of the Affordable Care Act require practical solutions that address both the immediate challenges of the pandemic and the long-term gaps in our healthcare system. Both have been laid bare by COVID-19. That is why United States of Care developed our 2020 Voter Action Guide to arm you, your friends, family, and colleagues with information about where and how to vote, key questions to ask of candidates between now and the election, and actions that you can take to engage directly with candidates. Specifically, USofCare's 2020 Voter Action Guide urges you to ask candidates the following questions to understand how they will address the critical gaps in our current healthcare system. Number one, both now and after the pandemic, what would you do to create a healthcare system that is reliable, fully resourced, and available whenever it's needed? Number two, what efforts will you take to improve our healthcare system to care for everyone, including people who are vulnerable and those who were already struggling before the pandemic hit? Number three, how will you ensure people can provide for themselves and their loved ones, especially considering the pandemic's financial cost? Number four, how will your initiatives make it easier for people to feel secure, free to make decisions, and that they have dependable healthcare coverage regardless of life's changes? And number five, what will you do to ensure we are prepared for future surges of the pandemic? Now, asking candidates questions is not enough in this election. USofCare also has outlined 6 easy steps to help you make your voice heard. Number one, make sure you are registered to vote and have a plan for how you are going to get to vote by mail or by voting in person safely on election day. Number two, research the candidates that will appear on your ballot up and down the ticket and know their positions on critical healthcare issues. Number three, use the United States of Care Voter Action Guide when you're talking to candidates. Number four, share the Voter Action Guide with your family, friends, and neighbors, and encourage them to reach out to candidates as well. Number five, Host or join a socially distanced or virtual coffee with candidates, a candidate forum, or other opportunities to share why access to healthcare is so important to you. And number 6, after you cast your ballot, be sure to add USofCare's I voted digital sticker to your social media profiles. You can download the image from our website's voter guide on the resources page. If you have any questions about how to register to vote, go to vote.gov for more information about registering in your state. If you have questions about voting early or voting by mail, you can go to usa.gov/absentee-voting. These resources and others are included in our USofCare 2020 Voter Action Guide. Your vote is so important, and USofCare is here to help you exercise it during this election. I now have the pleasure to introduce our next speakers. Andy Slavitt is the United States of Care Board Chair and founder. He served as the acting administrator for the Centers for Medicare and Medicaid Services under President Obama. Andy co-chairs the Future of Healthcare Initiative at the Bipartisan Policy Center and chairs the Medicaid Transformation Project, which aims to transform care for the most vulnerable. He is also the founder and general partner of Town Hall Ventures, which invests in healthcare innovations in vulnerable communities. He is host to the podcast In the Bubble. And from his own bubble, Andy is making it his mission to give Americans critical information in real time and hope for a path forward during this global pandemic. Andy is the author of the book Preventable, a definitive behind-the-scenes look at the US coronavirus crisis from one of the most recognizable and influential voices in healthcare. And Mike Birbiglia is a comedian, storyteller, director, and actor who has performed for audiences worldwide, from the Sydney Opera House to Broadway. His most recent shows, the new one, Thank God for Jokes, and My Girlfriend's Boyfriend, can be found on Netflix. Additionally, Birbiglia is a filmmaker who wrote, directed, and starred in the films Sleepwalk with Me and Don't Think Twice. His first book, Sleepwalk with Me and Other Painfully True Stories, was a New York Times bestseller, and he's the author of a new book, the new one, Painfully True Stories from a Reluctant Dad, with poems from J. Hope Stein. As an actor, Birbiglia has appeared on Inside Amy Schumer, Girls, and Broad City, and in the films Trainwreck, The Fault in Our Stars, and Pop Star. He plays Danny Pearson on Orange is the New Black and Oscar Lanstrat on Showtime's Billions.
Hey there, Andy.
Hey, Mike.
How are you? This is that was all really fascinating to me. Did you learn anything, or is that stuff you know already?
I know it in 5 languages. I was born knowing that how important we need to vote. That's what I took away. We need to vote. We need to tell other people to vote, or we are not going to get the healthcare we want.
Why you've spent, I would venture to say, thousands of hours on just healthcare as an issue, healthcare for Americans alone. So it's like, what gets you up in the morning working on just that?
Well, Mike, I think too many American families go to bed at night worried about whether or not they're going to afford to take care of themselves if something bad happens. And that's a horrible feeling. And I don't wish that feeling on anybody in this country. I think we can do better than that. I don't think anybody expects everything. I don't think anybody expects that the world is easy for them. We know it's challenging. But if we could take some of the basics off the table, people could wake up every day and know that if something happens, they can get excellent medical care that they can afford. We would be such a better country. Think about we talk a lot about freedom. Think about the freedom we would have to do anything we wanted, to have the jobs we wanted, to be happy, to do that. And many countries have done that. We haven't yet. And I think it's that yet that gets me out of bed in the morning, Mike, is the ability to, can we come together? And it's largely through days like November 3rd, 2020, that we have our greatest opportunity.
I feel like I feel like healthcare is something that a majority of Americans want. I feel like the ACA is popular, and yet, there's gridlock on expanding it and getting it for more people. And why do you think there's gridlock?
It's really funny, Mike, because the polls that USofCare has done and others have shown that, like, you're exactly right, like 70 to 80% of the public, regardless of how they identify politically, believes not just the ACA, forget that's a label, but believe in the things that the ACA brings that nothing else has ever brought this country. The ability not to be discriminated against because of pre-existing conditions, the ability to cover themselves when sick, the ability to help low-income Americans rise out of poverty through Medicaid expansion, the reduction in prescription drug costs, like all those things are widely believed. But it's not that it's never happened where we have a situation where our elected officials don't accurately represent our view. If you think about, there's a lot of policies that for some period of time, the politicians are still thinking the old way, and the public is way ahead of them. And so the public's job is to get our political class to catch up. It's not to despair. It's not to say, oh, I'm cynical about politics. It's to say, I'm going to get everybody I know that feels the same way I do, and even some people I don't know, because I'm going to call them on the phone and text them and knock on their doors, and I'm going to get them to vote. And everybody can vote the way they want. But if you vote in what you believe in, and you understand by things like this voting guide that Erin just put out, which is just really helpful, okay, which are the candidates that are going to make it so that I can sleep at night? And if, God forbid, someone gets a serious medical illness, like I know you've had and many, many people listening have had, which one's gonna make that easier for me? Then it will change. Yeah, put it in that. Looks like Mike's having a technical issue. He'll pop back in a minute, I'm sure. But in the meantime, maybe co-founder Natalie Davis can join. Yeah, so there are a lot of reforms that the whole American public agrees on, and I'll answer that first without talking about the Congress. But there's so many areas of common ground. I mean, mental health, expanded mental health coverage is something that everybody agrees on. The ability to treat addiction in a humane way, people agree on. People like things like telemedicine that's come on board. But at a more fundamental level, everybody wants healthcare to be affordable. Everyone wants it to be high quality, and everybody wants it to be broadly available. Now, how that translates into the political arena is a little bit different, because I think you have the sides of the aisle that are divergent. But look, we saw them come together in a couple of emergency bills on pandemic response. Sadly, that didn't hold. And we have a third bill outstanding which shows, hey, there's Mike, which shows that.
Join with my phone. I apologize.
Thank you, Mike, for dialing back in. We were just talking about where people agree and disagree, and I think it's a sad demonstration that we didn't get a third bill done to give people relief over the course of the pandemic. So I think we run into the limits where we have still too much disagreement in Washington. But I'm hopeful, because as Mike and I were talking about, Americans broadly agree.
I think, like, Andy, for the folks who are watching who might live in Florida or Georgia or South Carolina, I mean, you talk about like communicating with your legislators, but do those legislators, are they too much in their corner to care about your health care as someone who lives in Georgia, South Carolina, or Florida? And sort of, I guess I'd say,
Well,
like, how do we bridge that gap so that they're caring about their constituents?
I'll tell you, the only thing they care more about, any politician, than than money and lobbyists and these hard fought principles is losing their jobs.
Yeah.
So none of them want to be out on their butt. So they need to know how people feel. And so I don't care if you're in the reddest district in the country or in the bluest district in the country. If you get it through your head that what you want for yourself, the simple ability to take care of your family, is not a political question. It's not, you don't, there's no litmus test for that.
Right.
I guarantee you, when you're in the hospital with your daughter or your parent or your spouse, you're not sitting there thinking, thank God I'm a free market capitalist, or thank God I'm a,
That's right.
Whatever it is. All that goes out the window. And once we've had those experiences, it reminds us. And so we just have to remind our politicians, go ahead and have differences of views on other things. Go ahead and have differences of views on the margins on healthcare. You can have differences of opinion on how to get everybody healthcare. But if you are going to sit out there and support policies that take my healthcare away, I'm going to take away your job. Yeah. And that's the most power we have. And in 2018, people did that in droves all around healthcare. Yeah. And in 2020, healthcare and the pandemic together are the number one and number two issues people care about. We need to make sure that our elected officials get the message and that we vote accordingly.
What's been the most impactful conversation you've had with a lawmaker about healthcare? Like, what's the most memorable conversation you had where, like, you felt like someone maybe changed their mind on it?
Yeah, it's interesting. I've been doing a lot of campaigning and a lot of conversations. And my favorite conversations are the ones where people realize that they're saying the same thing in different ways. So, I try this thing, Mike. You might find that you might appreciate this. If I'm talking to a Democrat, I will say, a Democratic politician or candidate, I think we should have better coverage and lower cost healthcare, and they'll nod their head. And then I'll turn around and go to a Republican and I'll say, I think we should have lower cost healthcare and better coverage, and they'll nod their head. All I did was reverse the order, right? I said the exact same words, the different order. Yeah. And it's fascinating because when you do that, you realize there is so much ground, if you seek it, for a meeting of the mind. And I will tell you one quick story. I was talking to the head of the Senate of a state legislature who had very different political views than my own. And he wanted to know what I was doing in his office, and he didn't particularly probably care for the fact that I was from the Obama administration. And so he was very suspicious, and I came in and we had a conversation about some needs and some funding needs and so forth, and we talked about mental health and other things. It was kind of a cold meeting. And as I was walking out, I said, okay, this didn't go that great. He grabbed my arm. He said, can you stay back for a minute? I said, sure. He said, can I tell you something? I said, yeah, of course. He said, my brother has a severe mental illness. And I've never really told anybody about it, and I'm really worried about it. But what you said made sense to me, which is that people don't understand it. People don't invest in it. People don't, he gets discriminated against. He has a very sad life. And, I said, I'm sorry. I know that's hard. And it sounds like you really love your brother, and it sounds like you're a great brother. And I didn't use it to press the point to say, then why are you supporting policies that might hurt your brother? And I didn't use it in any political way. And I don't think I changed his mind on anything. I didn't really try to. But at that moment, I wanted him to feel like he had a meaningful interaction. I heard him. I wanted him to know he was heard. He's a real human being. And over time, I hope that he connects those dots. Like, he clearly hadn't connected the dots between his brother's health and the things he voted for. Maybe he will, maybe he won't. But it's those kinds of moments that I think we should all look for, whether we're talking to politicians or whether we're talking to each other, is when someone says, hey, I have this medical issue, this healthcare issue, et cetera. If you can help them see that we can make this country better and make those problems disappear or get much easier by how we handle it politically, then we're doing a great job.
But it's strange right now because there's so much disinformation and there's so much misleading literature and rhetoric. And so, like, the president will say, for example, I'm going to have an executive order for pre-existing conditions, or whatever the thing is that he said. And it's a little bit of a head scratcher, because is that even possible? Meanwhile, there's a Supreme Court case that's trying to dismantle the ACA. And so it's like, how do you parse through all of that stuff? There's so much conflicting information.
Well, one easy way is the president has something called the truth disorder.
So I've heard about that. That is a pre-existing condition.
Yeah, it is. It is. I mean, and just to stipulate the facts, I mean, you can't sue to eliminate 22 million people healthcare and make their health a pre-existing condition, and then sign a piece of paper. And look, I wish you could sometimes sign a piece of paper and make something happen. But an executive order, think of it this way. Think of it as a tweet on stationery.
Yes, sure.
That's all it is. It doesn't really have so yes, people, they know because they listen to us, they know that healthcare matters, and they know that that when you do a poll, people say they don't want to be discriminated against with pre-existing conditions. So every 2 years, people who have voted against things that make healthcare more available for people, for 1 month, October of an even-numbered year, they will say things that just don't reflect what they do the next 23 months.
Yeah.
Why this voter guide is important is because you have to look at what their record is. You look at what they do and not what they say.
Sure.
So what have they done, not what have they said. It's a very simple rule I try to keep in mind. If someone says something about, I'm really for more mental health access, but they voted against all the mental health care access bills, I'm going to go with what they've done, not with what they've said.
But I think the thing that's most daunting when I was listening to the speakers earlier, for me, as just a New York citizen, is I go like, well, how would I get in touch with my representatives? I live in New York. I've never met Mayor de Blasio. I've never met Governor Cuomo. I've never met, really any of these legislators. And so it's like, and it feels like social media is sort of, shooting something into the void. It doesn't really feel like there is a direct connection with politicians.
Right. I mean, don't you feel like if you tweet it, they're going to see it? No. The truth is, it's actually easier than ever. It's actually easier than ever. And here's why. So first of all, let me start with this. I heard something very important that came out of this side. We all think about elections as being for president or senator or congressman. There are hundreds of people that are elected to important jobs, state and local jobs every year. Jobs in the most important. But once people win those are the farm system for the big jobs. So if you don't vote all the way down the ballot, like Erin said,
sure,
then you're making a mistake. And so I would probably say that for every single person on this call, or most, your state representative or state senator or that race are having some sort of availability sessions via virtual, like Zoom or some other sort of hopefully safe way. Right now, they're getting out trying to see us. And so if we think they're hard to get a hold of, and sure, in a big city like New York or big state, talking about a national or state office, it may be harder to get the direct interaction. But for most places, they're dying to have the conversation with us right now. Like every voter they can talk to want to do it. Now they're having trouble because of the virtual stuff than we are, because they're trying to reach us. So if you go onto their website, whether it's your elected representative or their opponent, they will list their schedule. And and the good news is you don't have to go anywhere. It's going to be a schedule of virtual events. And people, like, bring 30 people wearing Healthcare Matters to Me t-shirts or Healthcare Voter or United States of Care. Because when they get online and see that, they go, oh my goodness, that is unbelievable. Like my wife works for an advocacy organization. They don't hold their own events. They have people's events and they bring 30, 40, 50, 60, 70 people to these virtual events, all wearing the t-shirt from their organization. And it sends an enormous message. So easy to send an enormous message. And guess what? That matters. That influences them in a great way. You can also call their offices, and each of their keeps a log of what the call's about. And the candidates look at those logs religiously because they want to win the election. So if they get 20 calls in a day from people saying, please take away my health care, they go, oh, I'm on the right track. This is good. I'm doing that. If they get 20 calls a day from people saying, don't take away my health care, I want better health care, etc., they will notice that. And that will flip into their message. Even if you're not talking to them directly, there's some ways you can get to them.
We were going to, I believe, take some questions from the board, but now that I'm on my phone, I can't seem to access where those questions are. I'm trying to find the bubble on my phone that would enable that. I was able to do it on the. Can you see it on yours? Can you do that?
I can see him. I can see him. Do you want me to read them, Natalie?
You should.
Should I read them?
You should read them to me, Andy. Then I'll take a swing and from the layman's perspective, and then you take a swing.
That's a great idea. Okay. Mike, why is healthcare an important issue for you when you're considering candidates to support?
It's not, Andy. I'm just so busy.
Okay. Wrong answer. Okay. Second, why is it important that voters understand candidates' beliefs and commitments when it comes to healthcare access and coverage? Okay, you guys did that one already. The sharp division caused by the electorate is palpable, and it's hard to talk with people. You have trouble talking with people, don't you, Mike? Even ones we love, about differing views. So this is a good question. What's the most effective way you've seen to cross the divide?
I think you hearkened to this earlier, but I think it's personal stories. I mean, for myself, I was not able to. I had bladder cancer when I was 19, and then in my 20s, when I was an independent contractor as a comedian, I couldn't get health care. I just couldn't get it. Pre-existing condition, I had cancer, and I don't want that to be. And now I'm in the actors union, and so I do have health care through that. But I don't want that to be the case for other people. I don't think it's fair. And I don't want to live in a country that doesn't take care of people who have that situation. So that's what I would say. What do you think?
Yeah, I told the story about your bladder cancer a lot.
Yeah.
It's true. Personal stories are the best way to connect to people because we've all had them. It's true. And I can't imagine being 19 and being that vulnerable and feeling like for the rest of your life, you may not be able to get insurance. And if that's what it feels, these college kids are getting COVID now. Imagine what happens when COVID's a pre-existing condition.
Oh my gosh. That never occurred to me until you just said that.
Because everything that goes wrong with your body can be tied to COVID.
Right.
Yeah.
Well, what about Andy? What about people who say that they don't want socialized medicine? They didn't get to pick their doctor. You see this on Twitter a lot. People get into warfare and they say, I didn't get to pick my doctor, and I didn't get this from the ACA, and I didn't get that. And so, what do you say to people who for whom that's their argument?
Let's fix every problem. Look, every problem's real. I wouldn't diminish anybody's challenge. The truth is, the ACA is not the Bible. It wasn't handed down from God. It was a piece of legislation that was got 75% right. And all good legislation had to be added on and corrected and improved. That hasn't happened here. So nobody should feel the need to defend something that was written 10 years ago as being perfect. They should be, though, expecting our politicians to say, fine, you don't like something about it? How would you make it different? I had a debate with Paul Ryan, a public debate not that long ago. And, he asked that very question. It's like, well, what about this flaw of your role as a speaker? The flaws. And I think one of the messages behind this organization is we're never going to have it perfect. That's why we need people that are committed to making it better and better and better all the time.
That's right.
And if we have a piece of legislation that one party says I refuse to do any work on, that's not a good situation. And both parties should work to make sure that doesn't happen, because one period of time Republicans will be in charge, the next period of time Democrats, another period of time it'll be mixed, and it'll go back and forth. If every time that happens, we have to throw out the entire healthcare law and start over, that's nuts. It's bananas.
It's a lot of wasted time.
Yeah, too much. And
by the time that's done, you'll be very old, Andy.
I'm already almost as old as you are.
All right, what's the next question?
Say things continue going exactly as they are right now. I think that means with our conversation. When do you suppose we would get back to normal life in that case? Say there was zero change in leadership or progress.
Oh, okay. For me.
Yeah.
Well, I think it'll be sort of like a Children of Men scenario. I don't know if you've seen that movie, where there's basically one more living child on the earth. What's your answer? I mean, mine's not scientific. I'm just taking stabs in the dark here.
Yeah, it's just a wild guess. I'm going to be a little more optimistic than you. I'm going to be sunnier than that. Look, I mean, the truth is, without getting too philosophical, the normal state of affairs in the world is there are viruses. We've just been protected from those viruses because we've had these defenses, the CDC, our wealth, our island nation status, our privilege, but we've given ourselves the illusion that they don't come here. And just the same way we did with foreign terrorism, we gave ourselves the illusion that it didn't happen here, and then 9/11 happened, and we're like, oh my God, the world's different than we thought, and the rest of the world is like, welcome to the world.
Yeah.
But you can live with viruses. They don't, we could still have a life. We could still, one of the reasons why it's wonderful that you're doing this is to remind people you can still laugh. You could, life goes on. And if you wait for I want my life to get back to the way it was in January of 2020, that's the wrong attitude, in my opinion. I think the right attitude is, I'm going to make the best life possible, and there are going to be some things that are going to be better. There'll be some adjustments we need to make, and over time, it may be that we have to change some habits, but it'll get better and better and better. The drugs will get better. There'll be vaccines that will help, but that doesn't mean that there won't be a season where people are at risk or high risk for COVID, and there won't be some activities we don't have to do differently. We may never shake hands again, Mike. We may only salute.
I will look forward to that. I think that the handshaking thing was overdone anyway.
Yeah.
Andy, I've been working on a vaccine myself. It's during the pandemic. It's 2 parts French toast, 1 part syrup. We're in third stage trials. The first 2 failed, but we're going ahead with it.
Did you go did you start in animals or did you start in humans?
We started in humans because it was just so tasty.
Okay. All right. It
was an anomaly. I mean, we had to make a call. Animals are humans, and it was like, well, why do they deserve French toast?
I was a little bit surprised that didn't get a lot of financial backing from the NIH.
I will say this. This is my comic relief in the thing, and I wonder if you experience this as well. Nothing is as it seems in the pandemic. Like you'll talk to your friends, and you'll be like, "How's it going?" They'll be like, "I'm having a great pandemic. I'm getting a lot done." And then next week they're like, "We're getting divorced." And the week after that, they're like, "We ate my grandmother." So it just feels like, wait, what happened to the having a great pandemic?
It can go down fast. It can go downhill fast.
It's been going downhill.
It can jump up fast too, Mike. I mean, it really can. I think the message, just you and I want to like both leave with a couple of messages for folks. I would say that vote. I mean, I'm not sure what the overall most important message is. You need to vote. That people need to think about, get other people to vote, and
yes,
register to vote. I'm searching for what the answer is here. Like I can't quite tell what the most important thing is. Like vote. You know what I mean?
Yeah, I think that's true, and I think there's a reckoning in this period of 4 years. There's been a reckoning for people, at least like me, who think, oh wow, it really is we the people. Like if we don't vote, if we're not involved, if we don't know about our local elections, then the whole thing actually can fall apart. Like it doesn't sort of take care of itself.
Yeah, like it's made of like Elmer's glue or something.
We thought it was glue.
We thought it was built on this like solid rock foundation. It's actually Elmer's glue.
It's paper mache and popsicle sticks.
All right. On that note, thank you so much, Mike, for taking the time to do this. You're a lovely human being.
Thanks, Andy. I love your podcast. I'm going to keep listening so that I know if I can leave my house.
Awesome. Let us turn it back to... Thank you, bud. Let's turn us back to Emily Barson.
Thank you, Andy, and thank you, Mike, and thanks to all of our speakers today. And thanks to you for joining us. We hope you found this useful. Please go to unitedstatesofcare.org to download and share the voter guide. I am proud to lead this unique organization at this critical time and thankful for your support and engagement. Our impact is dependent on the support and contributions from passionate individuals like you. You can donate to our work at unitedstatesofcare.org. Thank you and stay safe and vote.